Hello and welcome back to a brand new episode of Clotcast. I'm Dr. Yazan and today's episode is all about bleeding disorders. March is National Bleeding Disorders Awareness Month, and so today I'm going to explain what bleeding disorders are, how do they affect our body, how to recognize them, and why early recognition is so crucial and sometimes life-saving. First, I would like to briefly explain what normal clotting is. Our body has a very finely tuned clotting system that is designed to prevent excessive bleeding whenever we injure ourselves or fall or cut ourselves, while also ensuring that blood continues to flow normally in that blood vessel. Whenever a blood vessel is injured, that system activates rapidly in order to form a protective clot that seals the damaged site in order to prevent excessive bleeding as the blood vessel eventually heals. In order for that system to function normally, there are essential components that need to be intact. This includes the blood vessel wall, so the integrity of the wall itself, its ability to vasoconstrict, as well as platelets, which are blood cell fragments that are essential for the clotting system, as well as coagulation factors or clotting proteins that ultimately form a protein called fibrin that is necessary to stabilize the clot and make it stronger. All these different components have to work together in synergy, in a series of intricate and very tightly regulated reactions that ensure that blood clots only happen when they're needed and then dissolve when they're no longer needed. And so any defect in that system can cause serious complications on both ends. It could be too little clotting or too much clotting. Our bodies work really hard to ensure that balance. There's so many different reactions, so many different proteins involved, and that process is known as hemostasis, not homeostasis, hemostasis, which is our body's way of ensuring that balance of proper clotting. So too little clotting or deficient clotting can happen because of an deficiency or an absence or a malfunction of any of these components, and that can lead to hemorrhage or excessive bleeding, bruising. That can affect quality of life. It can be life-threatening, sometimes fatal. And then on the opposite end, too much clotting means that blood clots are occurring when they're not needed or they're not dissolving away properly or they're obstructing blood vessels. That can lead to complications such as blood clots in our veins, a deep vein thrombosis, blood clots in our lungs, other parts of the body, a heart attack or stroke, and all of these things can be quite serious and sometimes life-threatening. And so a tightly balanced clotting system or proper hemostasis is absolutely essential for our survival. And today I'm going to be focusing on bleeding disorders, which means that there's an impairment or a defect in that system that results in bleeding symptoms. And there's many, many different kinds of them. Some could be mild, some could be severe or life-threatening, and sometimes they could cause by hereditary or genetic defects, and others can happen due to acquired reasons, and there's many of them. And bleeding disorders result in a defect that can affect any of the three systems I discussed earlier. So starting with the blood vessel wall itself, for example, connective tissue disorders that can weaken the blood vessel wall, can lead to bleeding, or vascular malformations such as hereditary hemorrhagic telangiectasias. And then the next category is platelet disorders. So there are conditions that make the body have too little platelets in number or a functional defect in the platelets. So they're not functioning properly and they're unable to aggregate as they normally should and form a platelet plug. And here I'll also include von Willebrand disease, although this is not a platelet disorder, but rather a disorder of a clotting factor. But it is essential for proper platelet activation and aggregation. And then in the third category is coagulation protein deficiencies or abnormalities. I mentioned earlier that there's many different coagulation proteins or coagulation factors that work together in synergy to form fibrin. And this involves multiple series of reactions, and defects or deficiencies in these proteins can make the body unable to form fibrin or break it down too quickly. And you may be familiar with hemophilia A or hemophilia B, which are generally well known. And these are examples of a hereditary deficiency in factors 8 and factor 9 respectively that lead to a bleeding disorder and ultimately cause excessive bleeding and affect quality of life, and sometimes that can be life-threatening. Each of these categories represents a unique or a different pathophysiologic mechanism as to where the impairment could be in a broad sense. what is the defect that is leading to the bleeding disorder and its symptoms. And for that reason, bleeding disorders can have very different presentations and different symptoms. They can vary in severity, mild, moderate, severe, life-threatening, or they can vary in how they present, meaning where the bleeding occurs, what type of bleeding is happening, the timing of the bleeding, the location of the bleeding, and so on. And this requires a proper evaluation by a hematologist. However, they do all share a common theme in that they all lead to excessive or abnormal bleeding. And so today I want to talk about bleeding symptoms to be aware of or to recognize in a broad sense. And these are symptoms that you may have experienced yourself or run in the family, or you know someone who has them. So what are the symptoms of bleeding disorders? Common symptoms include excessive bruising, which could mean unusually large bruises or very frequent bruises, you're turning black and blue all the time, or unexplained bruises. And then nosebleeds that occur too frequently, typically since childhood, or for example, they're lasting too long and are difficult to control. Same thing with gum bleeds, or prolonged bleeding after minor wounds or cuts, typically lasting more than 10 minutes. Or bleeding that is deemed excessive after a dental procedure or dental work or any type of procedure or surgery where the person performing the procedure reports unexpected or excessive bleeding. And then there's heavy periods or prolonged periods, gastrointestinal hemorrhage. And also, of course, it's important to consider family history. If someone in the family has been diagnosed, then you could be at risk, especially if it's a hereditary genetic mutation that you could have inherited. And a lot of times patients may not realize that they have these symptoms because they might think it's normal, either because someone dismissed it, they told someone and they're like, yeah, maybe that's just the way you are, or maybe it runs in the family and everyone in the family is the same way, or they just never reported it. So it's important to be aware of these symptoms and recognize them, and if you have them or know someone who does, talk to your doctor about it and ask whether this is normal or abnormal, requires further evaluation or referral to a specialist. A bleeding disorder diagnosis does require a hematologist because we would perform the necessary tests and the clinical evaluation and so on to determine the most accurate diagnosis. I do see in my practice a lot of times patients are either misdiagnosed as having a different bleeding disorder than what they actually have, or just never diagnosed. They've had these symptoms for a very, very long time, and it was never diagnosed, either not recognized or they didn't report it, and so on. So it's really important to be aware of this and to advocate for yourself if you've been experiencing symptoms that just don't feel right and may be suggestive of a bleeding disorder. And the reason this is important is that not only could it impact your quality of life and well-being, but this could also, in some situations, be a life or death matter. Patients who have a bleeding disorder, typically one that is severe, and may, for example, require a emergent surgery, get into a car accident, or injure themselves, and do not receive the proper treatment of that bleeding disorder, may have a very serious and sometimes fatal hemorrhage. And so it's really important to be aware, and I hope that with this episode I brought someone's attention to these conditions. All right, so in summary for today's episode for National Bleeding Disorders Awareness Month, bleeding disorders are a broad range of conditions that lead to excessive bleeding and can be serious and are often under-recognized. And they result as an impairment in our body's normal clotting system and can lead to symptoms such as bruising, nosebleeds, prolonged bleeding after surgeries or wounds, heavy periods, gastrointestinal hemorrhage. And so recognition is very important. There's many different kinds of bleeding disorders that can have different severities and different symptoms. And if you think that you might be having any of these symptoms or know someone who does, proper evaluation is necessary and often requires a referral to a specialist, a hematologist, who is trained in the clinical and laboratory evaluation of these diagnoses, because having or making a correct and accurate diagnosis is essential for proper care and management and ensuring best outcomes. Thank you all for listening, and I hope you found this helpful. Please let me know what kind of questions you have in the comment section below. And in future episodes, I'll be discussing specific bleeding disorders and allocating an entire episode to each type of different bleeding disorder. So let me know if there's a specific type of bleeding disorder you'd like to hear about, and thank you all for listening.